A mastopexy is a surgical procedure most commonly known as a breast lift. Here we'll examine the steps of one of the most common procedures used today, known as an anchor lift or wise pattern technique, and compare them to the approach used in the Bellesoma method. Note that if you're considering a breast reduction, the same techniques are used, just excess tissue is removed. To begin, anchor lines are drawn and incisions are made along the markings on the breasts. The skin between the anchor incisions is then excised. The new skin edges are brought together, and the hidden nipple areola complex is then pulled through the skin edges and placed into its new position. Once the surgeon's pleased with the position and shape of the new breasts, the open skin edges are closed with sutures. This style lift works mainly on the bottom portion of the breast. Thus, if a more youthful and rounded appearance is desired, breast implants are typically inserted during surgery to create fullness in the upper portion of the breast. After completion of this lift, the breast skin remains as a support structure for the weight of the breast, and stress in the neck, shoulder, and back can remain. Next, we'll examine the Bellesoma method and how it differs from current techniques. Prior to surgery, a custom surgical pattern is designed for each patient based on their measurements and aesthetic goals. The procedure begins by making an incision around the areola. This is followed by a transverse cut above the areola and then along the inframammary fold. Lastly, an incision is made where the new nipple areola complex will be situated. The skin is excised, and then using the patient's own breast tissue, new breast mounds are created and elevated high up in the chest wall. The new breast mounds are then secured permanently to the pectoral muscles. The skin is then pulled down over the new breast structure, and absorbable sutures are placed at the new nipple areola junction and the inframammary fold. The design of this suture pattern hides the scars around the areola and in the shadow of the breast. With the lift completed, the weight of the breasts have been successfully transferred to the chest wall rather than the skin envelope used in traditional procedures. This creates immediate relief from back, neck, and shoulder pain. A comparison of both outcomes is shown here.